Good morning. It's Friday, February 17th. It must be time for another update from your North Carolina Medical Society. It's been a busy week. The tie had to go, and we've got a short update for you today. We're going to need you to look at the blog this week to get more into details, but I want to give you the highlights of what's happened. First of all, the federal government, we've seen a lot of activity around the exchanges. We've seen very little activity around the Affordable Care Act. Around the exchanges, we saw one of the biggest changes proposed this week that we've seen so far. We saw a rule announced by the Trump administration on Wednesday that would relax the process for the insurance companies going forward in the 2018 enrollment period. There are a lot of moving parts in there that could be very attractive to keep insurers participating in the exchange, and the overall effect is really not known yet. But we want to make sure that you see all the details of what is proposed in our legislative blog, as well as a place for you to comment on the rule if you would like to comment to the federal government about this change that is proposed. So look there, get up to speed on the details, and then go and make a comment on the rule if you'd like. At the state level, it's been a busy week, even though we're only at about 300 bills introduced so far. So we're still very early in the drafting and bill introduction process, but we've already seen bills on a wide spanning group of issues within Health and Human Services. So we've seen our first change to the abortion laws. We've seen helmet safety laws, or actually the relaxation of helmet requirement laws. We've seen workers' comp laws introduced. We've seen a number of different things around scope of practice that we've talked about with you around optometry. This week we saw the nurse bill, both in the House and Senate, introduced to eliminate supervision completely and go to complete independent authority for all advanced practice registered nurses. We're going to be talking to you a lot about that bill in the coming weeks. Be sure to look for an action alert about that next week. We oppose the bill as it stands right now, and we hope that you'll be reaching out to your legislators and telling them that you oppose it and why you oppose it. We still haven't even gotten to any of the Medicaid conversation yet. We fully expect that we'll be seeing a number of different bills, as well as budget language around changes in Medicaid. And oh, by the way, we had a presentation this week by Fiscal Research that said we've got $550 million in extra money to spend this year. So guaranteed, we're going to be around here late into the summer. So get ready. We're going to need you guys to stay focused for a long time. It's a lot harder to figure out how we're going to spend money. It's a lot easier to figure out how we're going to cut money and then go home. So I think that's our early sign that you're going to need to be watchful. You're going to need to be ready to stay in this game with us throughout the summer, late into the summer, talking to your legislators and communicating about the issues that are really important to you. A lot of those things that we just mentioned and more have come up and are going to be fully detailed, like I said, in our legislative blog, so be sure to click through and read that, and then always reach out to us with your questions and information that you're hearing from back home when you're talking to your legislators. We hope you have a great weekend, and we'll talk to you next week.